Anabolic steroids are synthetic hormones designed for a very specific job, forcing the body to increase lean mass and reduce fat. In this simulation of cellular muscle growth, fibers thicken and expand at an unnatural speed. It is a display of intense energy and biological power. But that power creates a dilemma. The exact physiological mechanisms used to preserve life in a clinical setting change their relationship with the body when they are used for aesthetic optimization. To understand the risk, we must examine this biological spectrum. On the far left, in a pathological deficit, steroids help patients with extreme illness. On the far right, fitness users push past natural limits to achieve a superphysiological surplus for extreme bodybuilding. To evaluate this fairly, we must look at how these compounds drive nutrient utilization, examine their use in bulking versus the cutting phase, and the systemic costs they require. This requires looking past the fitness industry hype to weigh the objective physiological promise against the clinical reality of the practice. The foundational use for anabolic steroids is in a medical setting. Here, physicians administer carefully controlled doses to patients suffering from muscle-wasting diseases or chronic illnesses. The goal of this input is to halt severe weight loss and preserve the lean tissue that is vital for the patient's survival. Even in this controlled environment, patients face managed side effects, requiring strict monitoring of the heart and liver. This medical exchange is considered justified. Accepting managed organ stress is a necessary trade to prevent life-threatening physical degradation. Fitness applications move away from necessity and toward the elective goal of enhancing nutrient utilization and training intensity. This microscopic view shows the unnatural speed of enhanced tissue repair, synthesizing protein to recover from muscle breakdown almost immediately. This allows an individual to train harder and more frequently than a natural athlete ever could. But generating mass at this speed places a heavy burden on the body. It accelerates wear and tear on connective tissues and strains the heart, which must pump blood to an unnatural amount of muscle. Superhuman recovery is a biological paradox. It requires placing a high level of stress on the cardiovascular system. This brings us to the most common application in the gym, the bulking phase. Bulking combines anabolic steroids with a massive caloric surplus to force systemic growth. The result is a rapid increase in body weight, muscle size, and absolute strength. Let's look at the systemic trade-offs for those gains. When detecting a massive surplus of synthetic hormones, the body protects itself, completely shutting down its natural testosterone production. Over time, this creates severe hormonal imbalance and the risk of long-term endocrine dependency. Essentially, the physical gains of a bulking cycle are rented at the cost of the body's natural hormone production. The second application, the cutting phase, flips the caloric equation. This involves using steroids during periods of severe calorie restriction to achieve a highly defined physique. The drugs prevent the loss of lean tissue that would biologically occur if the body were starving. Tricking the body this way has a psychological cost. Masking starvation signals often triggers mood swings and heightened aggression. Processing these compounds while in a caloric deficit forces the liver and heart to manage metabolic stress without the body's usual nutritional support. In this phase, the brain is forced to ignore starvation while the liver and heart absorb the invisible damage. To evaluate these substances fairly, we have to look at the total biological profile against the specific goals of the user. The evidence shows that forcing extreme changes in body composition guarantees exposure to hormonal, liver, and heart toxicity. This viability scorecard maps those risks against 3 different types of users. For the clinical patient, the utility is high. Halting tissue breakdown is life-saving, making the monitored medical risks worth the exchange. For the competitive bodybuilder, it's a professional gamble. They are trading long-term organ health for short-term competitive peaks. For the recreational gym-goer, the conclusion is absolute avoidance. The health risks are simply too high for elective use. When the only goal is aesthetic improvement, the math of risking your heart and liver doesn't add up. This balanced kinetic sculpture shows what happens to the human hormonal system when it is pushed out of balance by an unnatural weight. Natural limits exist to protect your internal organs. Overriding them is never biologically free. Anabolic steroids are potent tools. But the physiological price for looking superhuman is paid for by your long-term internal health.